Namaste and welcome to the next episode of Clinical Ayurved. Myself, Dr. Mayuresh Agte. We have finished Rasavira Vipak Prabhav and their clinical application in detail, and after that, we have moved towards the Vyadhi discussion. I want to clear you one thing that when we are discussing different Vyadhi, I am not going to take Nidan Panchak in detail because all of us have studied it in our education time. My effort will be to discuss with you the different shades of samprapti or symptoms, different shades of Sridan Panchak, between the lines which are not mentioned in the text. I will like to discuss the clinical conditions which we see in our practice which are not mentioned in our text as in detail and to find out their solution. So in general, in total, we will discuss the Vyadhi which are explained in Nidan Panchak, but the shades of that Vyadhi which are not mentioned in the text. I want to clear you again that another thing that when I am going to discuss these points, these are my thoughts or my opinions regarding that particular Vyadhi. I am not claiming anything that this my thinking process is accurate and it should be taken as it is. I will like to have your opinions on these discussions because we were going to, I am going to try to discuss those things which are not mentioned in text in detail but which are very much important when we see the patients. So, in that regards, we have started Kasa Vyadhi in the last episode, and I have asked you one question that in Samprapti, why Pranavayu becomes Pratilom? Udan makes it to flow the Pranavayu in its own direction, that is upward direction, and why it doesn't becomes vice versa? Means someone has uh, eaten ice cream. So Shitaguna Vata Prabhu is there. So Vata will get sorry, Prana and Udan both will get elevated. Then it should happen that Prana also makes Udan to flow in its own direction. But it doesn't happen. Udan makes Prana to flow in its upper direction and comes out as a cast disease. So we will discuss this point. Before that, let us focus on Pran and Udan first. Let us discuss their proper function. Now, what is the gati of Pran Vayu? It is Anulom. It is from Nasa to Urasthan. So it is external to internal. And Udan Vayu gati hi Urasthan Udan se Nasa Nabi Galasharir. It is from Nabi to Nasa. It is in the outward direction. So Pran Gati is inward direction and Udan Gati is outward direction. Now let us see functions of Pranavayu. What are they? Sthivana, Kshavatho, Udgara, Nishvasa, Anna, Praveshakru. Now what is Sthivan, Kshavathu and Udgar? Sneezing, belching. So these, what are the directions of this function? Akshavathu, splitting. This Sthivana, Kshavathu, Udgar, if you are one way saying that Pranavayu flows from outside to inside, inward direction, and these three functions, if we observe, they are exactly in opposite direction. They are from inside to outside. So how we can match this logic? If Pranavayu is flows from outward to inward, then why this function of opposite direction happen? Nishvasa Anna Praveshkrut, okay, logically it is they are very easy to understand that they are from outside to inside these actions. Nishvasa is taken, Anna Praveshkrut is taken. What about Sthivana Kshavatu Udgar? Now see, Sthivana Kshavatu Udgar. Are these actions routine actions of body? No. When there is sneezing, when there is something, particles go or some small strong smell goes. When there is spitting, when we have some awkward thing in our food and we throw it out. When there is belching, when there is some gas is formed and it is come as a udgar. So these are not the routine actions of the body like shwasa. These are routine action of the body. All these are reactions of the body. There is something which is unwanted comes in contact with the mouth or in nose or in stomach, and it is expelled out. And why pran makes these functions? Because it works as a washman in this nasa tract or anna praveshakrut tract. Shwasa and anna praveshakrut are these functions, but if the pranayamu allows unwanted material to go inside the body, this unwanted material from the food or say in the like pollens or pollution, whatever it is, it goes inside the body, then this unwanted material will make one or another problem on some day. So they are thrown out of the body immediately by pranavayu, and thus it works as a watchman at the gate, which allows only legal persons to enter in the institute or whatever it is. So though action or movement of pranavayu is from outward to inward, stimulus to udgar are the reactions which come under the pranavayu to throw unwanted material out of the body and prevent the further complications or further diseases. Hence, though gati of pranavayu is from outside to inside, these functions are controlled by pranavayu. Hope you understand these functions and actions of the pranavayu on the basis of direction it flows. In the next episode, we will discuss Udan Vayu Gati, Udan Vayu functions, and then we will move towards this, the question which I asked you on the Kas Valley, that why it is Prano hi Udananugata and not vice versa. Thank you very much.